Our second panelist for the 988-911 Emergency Response Panel is John Halaychik from the Tompkins County Emergency Response. Thank you, John, so much for being with us.
So if I can just tell you a little bit about myself, and then I'll get into what our department does and how 911 fits into this complex arrangement of pieces that are so important to mental health and suicide prevention. So I'm John Halaychik. I'm the County 911 Communications Center Manager. I've been here for a little over eight and a half years now. I've been in my career field for 34 years, and suicide prevention, mental health, exceptionally important to me. In my past, when I worked in the state of Florida, I served as part of the crisis intervention team in the greater Orlando area. Full disclosure, I do sit on the board of directors for Suicide Prevention and Crisis Service. Singularly, my position here today is as the Communications Center Manager. So with that said, what expectations, what do we do as far as 911 is concerned? So as many of you are aware, the 911 Communications Center for many people is the first point of contact should someone be in crisis or be thinking about suicide or be in need of resources. We are here 24/7, 365 to answer any calls for service and provide any assistance that we can through public safety resources as requested by the community. That being said, this past July, 988 was launched, and it has changed to some degree the way that 911 is operating and will consider how best to operate in the interest of the public moving forward. So that being said, 911 should be accessed when the situation is gravely acute. If the person has done harm to themselves already, if they are in a position where they have the immediacy to potentially do harm to themselves. So imminent threat is a term that often comes up. We are there to respond with our resources, and primarily that resource would be EMS, law enforcement. Bear in mind, not only are we attempting to help the patient in any way that we possibly can, but there is a safety component that 911 does have to look out for as well. So that's why the joint response. Moving forward, our department has been actively involved in new solutions, mental health diversion, routing individuals to 988 or to mental health for more appropriate interactions and facilitation of resources to individuals in the community that are in need. That really, I don't want to say unnecessary, but perhaps are not best served in the initial response by what has been a traditional model of law enforcement and EMS to respond to those situations. We look forward to working with our partners at mental health, at suicide prevention, and throughout the county to facilitate those individuals to the most appropriate resources. So that is an ongoing process. Another thing that we do here is when we receive a call of a psychiatric or crisis nature that is processed through our emergency medical dispatch program, it's handled as a medical call first and foremost before anything else. And there is a certain amount of intake questioning that occurs. And then based on that algorithm, that really determines who is going to respond to that particular call in need. Now, again, with the advent of 988, with the advent of mental health diversion within Tompkins County, there are some new initiatives that are out there that we are working through with our partners, mental health being one, Tompkins County Sheriff's Office being another. There are other agencies out there that are part of this discussion as well. And for us, it is the development of a correct process to divert many of those calls off to other resources. And that is an active process that is occurring. The other thing I would like to mention is this coming April, as part of our EMD program, there will be a national convention held in Denver. And one of the reveals within that conference presentation is a very robust mental health track for 911 public safety professionals. What does that mean for us? We have, in developing the mental health diversion process, wanted to create something that allows us to not have to reinvent the wheel, but something that would fit into the mental health diversion concept, specifically to provide that diversion seamlessly. Our EMD provider has recognized that this is not only occurring in Tompkins County, it's occurring throughout the country. And they have developed something called Caller in Crisis. It has not been revealed to the general public as of yet. The expectation is post-conference, it will probably come live within 30 to 60 days. So you're talking mid-year 2023. But that intake process will be new for all of our 911 personnel. And our sincere hope is that it will address the ability to divert calls correctly to 988 to other recipients, but yet fit within our EMD modeling, so as not to create a conflict between true bona fide emergencies that still will require a law enforcement EMS response versus being able to take a person, for example, they call, I would like to talk to somebody. That's vastly different than a imminent or grave circumstance situation, and we can facilitate that. So we're very hopeful that this is going to suit our needs and just add to the concept of mental health diversion within the county. But there are a lot of initiatives that are going on that we are involved with, and I think the following year will definitely move us forward in providing the right resources to the public as best as we possibly can.